In our last episode, we gave you the quick tour of all 4 parts of Medicare. Today, we're zooming in on the foundation the whole system is built on, Original Medicare, which is Part A and Part B. What they cover, what they cost, and just as importantly, what they don't cover. I'm Eric, and let's make Medicare easy. Let's begin with Part A, your hospital coverage. The simplest way to think about it, if you're admitted to a hospital as an inpatient, that's Part A at work. It also helps with skilled nursing facility care after a qualifying hospital stay, hospice care, and certain home health services. Now here's the good news most people love. For the majority of folks, Part A is premium free. If you or your spouse worked and paid Medicare taxes for about 10 years, that's 40 quarters. You've already paid into it, so there's no monthly premium. But premium free doesn't mean cost free. If you're admitted, there's a deductible per benefit period. In 2026, that's about $1,736. And here's a detail that trips people up. Part A works in benefit periods, not calendar years. A new benefit period can start if you've been out of the hospital for 60 days and then get admitted again. That's the kind of fine print we walk our clients through, so there are no surprises. Next is Part B, your medical insurance. If Part A is the hospital, Part B is basically everything outside the hospital walls. Your regular doctor visits, preventive care like wellness visits and flu shots, outpatient procedures, lab work, and durable medical equipment like wheelchairs or walkers. Unlike Part A, Part B does come with a monthly premium, and for most people, it comes right out of their Social Security check. In 2026, the standard premium is a little over $200 a month, though higher earners can pay more based on income. Part B also has its own yearly deductible, around $283 in 2026. And after that, here's the big one. You typically pay 20% of the cost of your covered services. That 20% is called coinsurance, and remember that number because it's about to matter a lot. Real quick, if this is making Medicare feel a little less overwhelming, do me a favor and tap that like button. It genuinely helps more seniors and families find these videos when they need them. Alright, back to it, because this next part is the one nobody warns you about. So we said Part B leaves you paying 20% of covered services. Here's why that's a big deal. Original Medicare has no cap on your out-of-pocket costs. None. Think about that. If you had a serious illness or a long hospital stay, that 20% could keep adding up all year with no ceiling. For most other insurance you've had in your life, there was a maximum. Original Medicare on its own doesn't have one. On top of that, Original Medicare doesn't cover routine dental, vision, or hearing, and it doesn't include prescription drug coverage at all. That's not a flaw in the system, it's by design. Medicare expects you to fill those gaps, and that's exactly where Parts C and D come in, which are our next 2 episodes. So how do people handle those gaps? Generally 2 ways. Some people keep Original Medicare and add a standalone Part D drug plan plus a Medicare supplement. Others choose a Medicare Advantage plan, Part C, which bundles it all together. We'll break both down in the coming episodes. One more thing that matters, timing. There are specific windows to enroll in Part B, and if you miss them without other coverage, you can face a lifelong penalty. So knowing your enrollment period isn't optional, it can literally cost you every month for the rest of your life. So to recap, Part A is your hospital coverage, usually premium free. Part B is your medical coverage with a premium and that 20% you pay. Together they're Original Medicare, a strong foundation, but one with real gaps and no spending limit. And filling those gaps the right way, that's where we come in. Next episode, we tackle Part C, Medicare Advantage, and how it can pull all of this into one plan. So hit subscribe and ring that bell so you don't miss it. And if you'd rather just talk it through with a real person, give us a call at Allen & Associates. We make Medicare easy. See you in the next one.